I do a fair amount of content about the American healthcare system and how much it costs us here in the United States of America to get healthcare. And I talk about how you pay hundreds of dollars a month to have health insurance, and then you still have to pay a copayment when you go to see your doctor. For me, it's $100. You have to pay a copayment when you go to see a specialist. For us, it's $150 for a specialist. You still have to pay when you go to the hospital, out of pocket a certain amount. You have to meet certain deductibles and things like that. So you wind up paying far more for your health care, even though you have insurance. This person sort of rightfully, said, so basically you're paying insurance for nothing at all. Canadians, take notice of this, please. The Canadians should take notice because they shouldn't want anything to do with our healthcare system whatsoever. But what we pay insurance for here in the United States of America, mostly, this is obviously, you can't paint everybody with a broad brush because some people have better insurance than others, but what we pay for health insurance for here in the United States of America is basically so that if you have a heart attack, it doesn't cost you $150,000. It costs you your $7,000 out-of-pocket deductible. If you have a hip replacement, like I did, it doesn't cost you $250,000. It costs you the $7,000 deductible that we had. That's why we pay for health insurance in the United States of America, to avoid owing six figures because we got sick, to avoid owing. My father, the last 4 years of his life, now he obviously wasn't on private health care. He had supplemental health insurance, but he was on Medicare. He was riddled with ailments, and one of the things that he needed to do on a daily basis was dialysis. This was his bedroom, and he had dialysis supplies stacked up in the closet, and every day he would have to, for lack of a better way of putting it, drain himself and run new dialysis solution through his body. He had to do dialysis once a day. Medicare picked up that bill, but we still got the breakdown of what that cost and what Medicare was picking up. $58,000 every month. And that was just for one of his diseases, right? Just one of them. 58 grand a month. If you have health insurance in the United States of America, it's so that you don't have to pay $60,000 a month in order to stay alive. You'll have to pay X amount of money. You'll still have to pay, but at least it won't bury you. That's why we have health insurance in the United States of America. It's one of the most fucked up systems you've ever heard of in your entire life. You pay hundreds of dollars a month, just to have insurance that doesn't cover everything that you could possibly get. And the health insurance companies can just drop you, in many cases, prior to Obamacare, could just drop you if they in the fine print somewhere in your insurance, it says that they'll pay out, let's just say $1 million. And then you get cancer and they pay out $1 million worth of shit, but you still need years worth of treatment. They can go, we paid our $1 million, we're done with you, you're high risk. Yeah, Canadians should take note.